Epidemiological evidence suggests a role for coffee in reducing the risk of type 2 diabetes. Does your work confirm this?
Yes, our work definitely confirms it. Well, my previous work was the first paper actually showing that people who drink more coffee have a reduced risk of diabetes. And lately we saw that also. Actually, it was in elderly men and in elderly women and in obese and in non-obese. Actually, what we saw, it was quite robust. So actually, maybe the first time in my life working in nutrition and epidemiology that you see such a robust association in our own cohorts, but also in the ones in the literature. Yeah.
Can you comment on the levels of coffee consumption linked to a reduced risk of type 2 diabetes?
Yeah, I think that's an important issue. It's also a difficult issue because, 1 cup, we just discussed here in Spain, the cups are small. In the United States, you have a mug, but then they have more, not less strong coffee. So maybe the total in the number of compounds is maybe the same in a small cup than in a large cup. Complicated issues. But if you look at the literature until now, you see that actually with every cup the risk reduces. And the averages that they say based on all the literature, you can say for each cup your risk reduces with 7 to 8%. But of course, if you are not drinking and drink 1 cup, maybe that the difference is not that big. But what we see in the Netherlands, for example, we drink quite a lot of coffee. So if you have people who drink less than 2 and people who drink more than 4, which is already quite a distance, there's really a substantial lower risk, a reduced risk of 30 to 40%. So, yeah.
What are the implications of these findings on diabetes prevention?
Actually, that's quite interesting. The nice thing about coffee is that I think the first time I look at the component which we were always thinking is not so healthy, and at least in the Netherlands now we still think for pregnant women, you should be careful. But for cardiovascular disease or hypertension or even sleep, it depends on your own, you notice when you don't sleep. But for the risk of future diseases, we think, there's no elevated risk, and if there is, it's a reduced risk, like for diabetes or for cognition. But in the field of diabetes, we always think about changing our lifestyle, and that's not that easy, like reducing your body weight. I mean, reducing your body weight is the best way to prevent diabetes, which is by a healthy diet and by increased physical activity. But what we see actually that what you can reach with diet and physical activity is only a reduction of 5 to 10% in your body weight. I mean, much more isn't possible. We could still, I would like to, but no. So if coffee can help, I mean, every reduction is a good thing. So from that point of view, I'm not sure if I could say I recommend it wholeheartedly, but a moderate amount definitely is useful.